If your healthcare professional has recommended a pelvic wand to you and you have opened the box, stared at it, and put it immediately back, this video is for you. Hi, I'm Richa Rehan. I'm a pelvic health physiotherapist and I want to walk you through exactly how to use this tool, why it works, how it works, and what most people get wrong when they start with it. So first things first, what is pelvic wand and what it is for? A pelvic wand is a curved therapeutic tool designed to reach the deep internal pelvic floor muscles that you simply cannot access from outside. It can be used vaginally or rectally, and it's relevant to both men, women, and all the genders. And it's commonly recommended for tailbone pain, coccyx injury, deep pelvic pain, pressure, pain with sitting for long periods, sometimes post surgical scar tissue, and pelvic floor tension, which is far more common than how much people realize. If your pain is like deep, aching, and feels like it's sitting right at the base of your pelvis, this tool is designed for you. Now, you must be thinking that why can't we just stretch it externally like other stretches and other muscles? Your pelvic floor have a superficial layer and a deep layer. The deep layer muscles like obturator internus and the deeper fibers of levator ani sit so far inside the pelvis that no external massage, no foam roller, no glute stretches. Sometimes it's just the stretches are not able to get it to these muscles. And that's not a flaw in your treatment, that's your anatomy. The wand exists because sometimes the only way to release these muscles by going directly onto those muscles. Before you start, three things before you even pick up the wand. One, this should never be painful. Mild discomfort at a trigger point is okay, but sharp pain is a big no. So if you feel sharp pain, you stop right there. Number two, lubrication. Lubrication is not optional. Use a generous amount of water-based lubricant every single time you use it. And third, your nervous system. Your nervous system needs to feel safe before your muscle will release. That means you need to be warm, private, unhurried, and breathing. If you're tense and rushed, the wand will not work. The muscles will guard you and you will get nothing from the session. So you need to be relaxed. Now, let's talk about positioning. So find your position what works for you. Lie on your back with your knees bent and your feet flat, or on your side in a loose fetal position. Either works. The goal is full body relaxation before insertion. So before you do anything else, take 5 slow diaphragmatic breaths. Inhale through your nose, let your belly relaxes, and on each exhale, consciously let go of everything between your sit bones. You're preparing your pelvic floor to receive this tool, not bracing against it, and it will make a big difference. Now let's talk about the insertion. So apply lubricant to the wand and to the anal opening. On an exhale, when your pelvic floor is at its most relaxed, and because you're using it rectally, gently introduce the slimmer end of the wand. Go slowly. There's no benefit of going fast. You're not trying to reach destination. You're listening to your body. You're listening to your tissues because your tissues tell you when it's too much resistance. So if you feel resistance, you stop, breathe, wait for the muscles to soften and relax, and then continue to insert it slowly, only to a comfortable depth. It doesn't mean like the deeper the better. No, just to the comfortable depth. Once inside, very gently angle the wand towards the side walls of the pelvic floor. You're looking for a spot that feels tender, tight, or reproduce a similar aching sensation. That is a trigger point, and that is where you will just stay. The pressure I want you to use is think about checking a piece of the fruit at a grocery store. Enough pressure to feel the texture, not enough to squish it or bruise it. So you're working with a sensitive, complex tissue. So you have to respect it. Now, how to release that trigger point? Hold that gentle pressure for 1 or 2 minutes. Don't increase it. Do not move around looking for more. While you're holding it there, breathe. And here's what I want you to try. While holding the wand there, now slowly move your leg. Like bring your knee towards your chest, rotate it outwards. find a position where the pain or tenderness at that trigger point noticeably decreases. There's a position for each muscle where it shortens and just enough to quiet the pain signals. Find that position and hold it for the full 1 to 2 minutes up there. When you're done with one point, release the pressure slowly, rest, breathe, and then move on to the next trigger point. Work 1 to 3 trigger points in each session, not more. More is not better. Your nervous system needs time to process what you have just done. Now, what's after your session? After your session, remove the wound slowly on an exhale. Clean it with warm water and mild soap. After your session, move. 5 minutes of walk, some gentle movement. You want blood flowing to those muscles while they are still in relaxed state. You may feel some mild achiness for a day or two after your first few sessions. That is normal tissue response. But significant pain after a session is a signal to back off and reassess. Now, how often should you use it? Daily use is appropriate for most people. Even a couple of times in a day if your pain is significant. This is a safe tool to use when recommended by your healthcare professional. Results are not instant. Pelvic floor tension that has built up over weeks, months, or years does not release in one session. You're building a new relationship with your tissues and muscles, so give it time. A wand is a self-management tool. It's not a replacement for an assessment and the treatment done by a pelvic health physio. If you have been using it consistently for 4 to 6 weeks and your pain is not shifting, please see a pelvic floor physiotherapist. There may be something structural, neurological, or muscular going on that needs hands-on clinical assessment. Self-treatment is powerful, but it has limitations. Knowing when to get a help is a part of a process. So save this video so you have a full technique to come back to. And if this is the first time someone has explained to you that how your deep pelvic pain has a name, a cause, and a treatment, I'm glad you found this video. Drop a comment below telling me where you are starting from. I read every single one of it. And if you want to go deeper into the pelvic floor tension and how it shows up in your body, stay tuned for the next video.